Hello, my name is Courtney Selg. I want to begin this interview by thanking everyone involved in the graduate and admissions process at St. Catherine University. Thank you for taking the time to review my application and hear my story. My motivation to become a nurse is deeply personal. In 2023, while on a family vacation, my father fell and sustained a severe spinal injury. After arriving at the hospital, he was sent to a rehab facility where he received poor treatment that led him to become septic with a collapsed lung and pneumonia. When I was just 19, my father was deemed a quadriplegic and put on a ventilator. He lost his ability to walk, speak, and live life as he always knew it. He spent months in the ICU trying to regain what he had viciously lost, and while those months were incredibly difficult, they are also where I first witnessed the profound role of an advanced practice nurse. One provider, a wound care nurse practitioner, was eventually introduced to his case. She was the first medical professional who truly centered his humanity. She advocated for him not just medically, but also emotionally. She treated his wound with technical precision while also treating him with dignity and our family with respect. In a moment of vulnerability and fear, she gave my father care that honored his humanity. Though my father passed away not long after, the compassion and advocacy she demonstrated is what set me on this path. I want to become that kind of provider, someone who shows up for people when they need it most, and who protects their well-being and dignity. I'm choosing a graduate entry nursing program because I want to build a strong foundation in evidence-based clinical practice and leadership from the very start. Graduate study will allow me to gain the advanced knowledge, technical expertise, and critical thinking skills needed to provide high-quality, patient-centered care and to advocate effectively for vulnerable patients. My expectations of graduate study are that I will be working to gain advanced clinical knowledge, refine my technical skills, and develop the critical thinking necessary to provide safe, high-quality, patient-centered care. I expect rigorous coursework that challenges me to integrate evidence-based practices with real-world clinical decision-making, and simultaneously engage deeply with faculty and peers, learning from their experiences while contributing my own perspective as someone who has advocated for medically vulnerable patients in the past. Ultimately, I see graduate study as an opportunity not only to expand my medical knowledge and leadership abilities, but also to strengthen my ability to advocate for patients, ensuring their dignity, safety, and well-being are always prioritized. Two personal qualities that will support my success in the MSN entry-level program are advocacy and resilience. Advocacy has been central to my professional experience as a house lead at Summit Therapeutic Services, where I advocate for clients' health, safety, and overall well-being by supervising direct support staff. In this position, I also ensure that our care aligns with individualized care plans and safety standards, and work to collaborate with healthcare providers to monitor vital health indicators and ensure timely medical interventions for our clients. In addition to this direct care, I also mentor and train new staff, emphasizing accurate medical documentation, adherence to care protocols, and best practices for behavioral and medical support. Resilience has been equally essential in both this role and my work as a mental health worker at Kirby Hills Behavioral Health. In this position, I provide empathetic support to individuals navigating mental health challenges, implement crisis intervention strategies, and monitor behavioral and medical progress in an inpatient psychiatric setting. These experiences have strengthened my critical thinking, professionalism, and ability to remain composed under pressure. Together, advocacy and resilience have allowed me to lead teams effectively and ensure patient-centered care, and I plan will continue to guide me as a graduate student, helping me navigate complex clinical and academic challenges with determination and empathy. St. Catherine University is the program that aligns most strongly with my values. The opportunity provided here at St. Catherine's to gain advanced clinical expertise, learn from experienced faculty, and participate in hands-on, patient-centered training excites me because of its focus on advocacy, leadership, and high-quality care. I'm drawn to the ways this program emphasizes preparing nurses to make meaningful differences in the lives of medically vulnerable patients. Working in demanding care settings while managing professional responsibilities and navigating complex medical and behavioral situations has given me the time management, emotional resilience, and professional maturity needed for graduate level training. I'm excited to bring that same commitment to St. Catherine University's program and to serve patients with the level of compassion, expertise, and advocacy that once changed my own life. Thank you again for your time and consideration.